is Josh. I'm a nursing student, and I'm going to do a cranial nerve assessment on Jake here. First cranial nerve is the olfactory nerve. It's going to test his sense of smell. Could I have you plug a nostril, please? Let me know what scent you smell.
Spearmint.
Now, the other nostril, please.
Rubbing alcohol.
It's able to identify both scents, indicating that the first cranial nerve is working correctly. Now, the second cranial nerve is the optic nerve. I'm going to have you cover one eye. Read the first line, please.
Every eye in the room was on us.
Cover the other eye. And the first line.
Okay, now you're creeping me out.
Thank you. Optic nerve is functioning correctly. Going to check the third, fourth, and sixth cranial nerves. That would be ocular motor. 6 is abducens, 4th is trochlear. Ocular motor, trochlear, and abducens. Could I have you look back at the cabinets? Now in at the pin light. Back at the cabinets. In at the pin light and follow it in. Thank you. Keep following. His pupils are 3 millimeters, equal, round, reactive to light, and accommodate, indicating that the third cranial nerve is working correctly. His eyes were able to track both eyes at the same time, indicating that the trochlear is functioning correctly. And he was able to track without any nystagmus, indicating that the abducens is working as well. Now for the fifth, the trigeminal. Could I have you look up, please? Alright, could I have you close your eyes? I'm going to touch you. Let me know when you can feel it. Touch you with something soft.
Okay. 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 Okay.
Alright, and this time there are 2 touches, blunt and sharp. Do you feel sharp or blunt?
Sharp. Blunt. Sharp. Blunt. Sharp. 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 Blunt.
Alright, keep your eyes closed. It's going to feel warm or cold.
Warm. Cold. 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 Warm. Cold.
You had a proper blink reflex. Could feel soft touch and sharp and dull, as well as warm and cold. So trigeminal nerve is working correctly. Now for the 7th, facial. Could I have you smile for me? Frown. Puff out your cheeks. Close your eyes tightly and raise your eyebrows. Thank you. I'm going to have you do 4 tastes. Let me know which one you taste. It's sweet, sour, salty, and bitter.
Ooh, sour.
Stick out a little bit. Thank you.
Salty. Bitter. Oh, that's sweet. That is sweet.
Take a second. All right.
Bitter.
He was able to identify all 4 flavors, and he was able to raise his eyebrows and smile, check everything for the facial nerves working correctly. Next, vestibular cochlear, the 8th one. I'm going to whisper to you random letters and numbers. I want you to repeat them to me.
7AZ. QA72.
All right. Could I have you stand up? Take a few steps and then return. He was able to hear me whispering even when I gave him 4 letters and numbers instead of 3. And his gait was correct, sense of balance was intact, indicating that the nerve, the 8th nerve, is working correctly. Now for the 9th, glossopharyngeal, to have you open your mouth. Alright, say ah. Ah. Again, ah. Can you swallow for me again? Alright, the uvula raises when saying ah, the gag reflex is present, and the swallow is present as well, so the glossopharyngeal is working. And also there's no hoarseness in his voice, and the swallow was working, so the vagus nerve, 10, is functioning as well. Alright, can I have you press hard against my hand, and again, and shrug your shoulders up. Thank you. The 11th nerve, the cranial nerve, is functioning properly as well. Now, hypoglossal. Could I have you stick your tongue out, please? Go up, down, left, and right. Hypoglossal nerve is functioning properly as well. This ends a cranial nerve assessment. Everything seems to be functioning fine. Thank you.